think y'all have about every angle you can get of the witness. Thank everybody for being here. Bobby, I see your family behind you, and I like your family except for the nephew who's a Florida Gator. We'll let that go. The Senate Committee on Health, Education, Labor, and Pensions will please come to order. Again, Senator Kennedy, Bobby Kennedy, thank you for appearing before the committee and for your willingness to serve our country as your family has served our country. You and I have talked at length about a variety of issues impacting Americans' health. These have been candid conversations, and I very much appreciate your willingness to engage. And there are many things you and I agree on. We're in total agreement on the need to address ultra-processed food, to reduce obesity. And obesity, of course, the leading cause of chronic disease and therefore of shorter lifespans. And this will be a priority in this committee, and I look forward to collaborating with you if you are confirmed. But it's no secret, I have some reservations about your past positions on vaccines and a couple other issues. And so we know a lot about you. I'll tell you a little bit about myself. Before I entered politics or even thought about running for office, I practiced medicine for 30 years, working in public hospitals in California and Louisiana, specializing in liver disease, caring for those who otherwise would not have had a specialist. If you will, dedicating my life to saving lives, that is, being a doctor. Now, there is a moment in my career that really informs me now. In the early 2000s, I was loading a patient onto an air ambulance, an 18-year-old young woman, to go to get a liver transplant from acute liver failure due to hepatitis B. Barely an adult, her entire life ahead of her, all the hopes and dreams she might want, the children, the grandchildren, the future generations, wiped away if she did not get to the LSU hospital in Shreveport for an emergency transplant. Now, the transplant, an invasive, in 2000, $250,000 surgery that had a 5 to 10% mortality rate, but even if she survived, would leave her with a liver transplant and hospital bills every year of $50,000. And as she took off, it was the worst day of my medical career, because I thought $50 of vaccines could have prevented this all. And that was an inflection point in my career. And since then, I've tried to do everything I can to make sure I never have to speak to another parent about their child dying due to a vaccine-preventable disease. So I worked with community and business leaders to form a public-private partnership in the capital region of Louisiana. We vaccinated 36,000 children for hepatitis B. And since the CDC and the ACIP have recommended universal vaccination for children, the number of acute hepatitis B cases in our country has declined by almost 90%. So as a physician who's been involved in immunization programs, I've seen the benefits of vaccinations. I know they save lives. I know they're a crucial part of keeping our nation healthy. Now, Bobby, I've learned you got a tremendous following. My phone blows up with people who really follow you. And there are many who trust you more than they trust their own physician. And so the question I need to have answered is, what will you do with that trust? Whether it's justified or not, and you may not want this to be the case, but I have constituents who partly credit you for their decision to not vaccinate their child. Now, that's a real conversation. And I'm hearing from them, and they want you confirmed. Now, you're going to tell us this week, as you did, I think you'll tell us today, as you did in Finance Committee yesterday, that you're pro-vaccine. So what will you tell the American mother? Will you tell her to vaccinate her child or to not? Or to have a conversation with her doctor, but for many that will be permission to not vaccinate their child. We know that to be the case. So your past of undermining confidence in vaccines with unfounded or misleading arguments concerns me. Can I trust that that is now in the past Can data and information change your opinion, or will you only look for data supporting a predetermined conclusion? This is imperative. You will have the responsibility to restore trust in our public health institutions in this position you have. Now, let's turn a little political. I want President Trump to be successful. It's important for our country. Any action you take as HHS Secretary will shape his legacy, and we both want that legacy to be positive. So, thank you for coming before the committee, for being willing to serve, and I look forward to today's conversation. And with that, I yield to my ranking member, Senator Sanders.
Thank you, Senator Cassidy, Chairman. And Mr. Kennedy, thanks for being with us. I'm going to discuss later the issue of vaccines, which Senator Cassidy raised, and is of concern, I think, to all of us. But before I go there, I wanted to congratulate you, in a sense, for the phrase, "Make America healthy again." I think that is a cry that all of us share, because, as you've indicated, we're a very unhealthy society. We are the richest country in the history of the world, and yet we rank far below every other major country in terms of our life expectancy. That's outrageous. To me, equally outrageous is if you're working class in this country, you're going to live 6 or 7 years shorter lives than if you are rich. In America today, 68,000 people die every year because they can't get to a doctor. They can't afford to get to a doctor. You pointed out yesterday the outrageous cost of healthcare in America, 2 or 3 times more than other industrialized countries are paying. Unbelievably, in this country, hundreds of thousands of people deal with cancer, struggling for their lives. You know what happens to them? They go bankrupt. They deplete their lives' savings. In other words, when we talk about making America healthy, you got to talk about a broken, corrupt healthcare system. Your uncle, President Kennedy, your father, Bobby Kennedy, great senator from New York, your uncle sat right now where Senator Cassidy is sitting, chairman of this committee. All of them did what I think is the right thing. They said healthcare is a human right. They looked all over the world. You saw every other major country guaranteeing healthcare to all people, whether they're rich or poor, young or old. So I'm not quite sure how we can move to making America healthy again unless we have the guts to take on the insurance companies and the drug companies and guarantee healthcare to all people. I'll be asking you a question about that. Lowering the cost of prescription drugs. How do you make America healthy again if 1 out of 4 people in this country cannot afford the price of prescription drugs, which is far higher in America than any other country on earth? Under President Biden, we made some progress, and this committee played an active role. Follow what we accomplished here. We are the only major country on earth not to guarantee paid family and medical leave. Mr. Kennedy, there are women today who are having babies, then they got to go back to work in a week or 2 because they have no guaranteed paid family and medical leave. How do you have a healthy country when women are forced to go back to work, when women and men get fired because they stay home taking care of their sick kids? That's not making America healthy again. And I would go a little bit beyond the jurisdiction of Health and Human Services, but I think it's important. If you are working 50 or 60 hours a week, making 13, 14 bucks an hour, which is what millions of Americans are, can you be healthy? Will you join those of us who think that in the United States, wealthiest country on earth, people work 40 hours a week, they should not live in poverty, got to raise the minimum wage to a living wage? And lastly, and we discussed this very briefly, President Trump believes that climate change is a hoax. I happen to believe, and most Americans believe, and virtually the entire scientific community believes, that it is an existential threat to this planet. I don't know how you're going to make America healthy again, or keep the world healthy, when you have massive heat waves and droughts and floods and extreme weather disturbances. Louisiana had them, Vermont had them. That's not keeping America healthy. That's not within the jurisdiction of HHS. But I surely hope that you will, if you are confirmed, demand that President Trump change his position and work with those of us who are trying to transform our energy system and, in fact, keep America healthy by addressing the crisis of climate change. Thank you, Mr. Chairman.
Thank you, Senator Sanders. And now I'd like to welcome our nominee, Mr. Robert F. Kennedy, Jr. Mr. Kennedy has a long career as an attorney and advocate for various health and environmental concerns. He has championed a range of issues like healthy foods and efforts to fight chronic disease, while calling for greater transparency and accountability in our public health infrastructure. Mr. Kennedy has an important opportunity to reform the department and to restore trust in our federal health agencies. I look forward to hearing more about his policy priorities and his plans to advance President Trump's agenda to make America healthy again. I thank you for joining us today, and I'll now turn over to Mr. Kennedy to introduce himself. Is your microphone on? Is your microphone on?
Thank you, Chairman Cassidy. Thank you, Senator Sanders. Ranking members and Ranking Member Senator Sanders and other members of this distinguished committee. Cheryl and I were heartbroken last night to learn of the tragic accident that took so many of our fellow Americans, including our service members. We are in an apartment where we were able to see the rescue operations from our window. Senator Marshall, please know that I will continue. There you are. I'll continue to pray for you, as I texted you last night, for those who were lost, who called your state home, as well as Senators Kaine and also Brooks. We appreciate the first responders and local officials who are working so hard. May God continue to be with us all who are impacted and those who continue to help with the recovery. I'm humbled to be sitting here today as President Trump's nominee to oversee the U.S. Department of Health and Human Services. I want to thank President Trump for entrusting me to deliver on his promise to make America healthy again. I'm grateful to have my family here once more with me. I want to introduce my wife, Cheryl, my daughter, Kik, my son, Bobby, my daughter-in-law, Amaryllis, and my nephew, Jackson Hines. I want to thank them, as well as the many members of my large extended family, for the love they have so generously shared. I want to particularly thank you, Mr. Chairman, for the time you've spent with me and the times we've talked in person and by phone. I greatly admire your passion for public health and your commitment to science. And this committee is blessed to have a medical doctor at the helm and two other medical doctors, Dr. Marshall and Dr. Rand, on the committee. I explained yesterday to the Finance Committee that my journey into the issue of health began with my career as an environmental lawyer, working with hunters and fishermen and mothers in the communities and small towns along the Hudson River. I learned that human health and environmental health are intertwined and inseparable. The same chemicals that kill fish also sicken human beings. Today, Americans' overall health is in grievous condition. Over 70% of adults and a third of children are overweight or obese. Diabetes is 10 times more prevalent than in 1960. Cancer among young people is rising by 1 or 2% per year. Autoimmune diseases, neurodevelopmental disorders, asthma, Alzheimer's, ADHD, depression, addiction, and a host of other physical and mental health conditions are all on the rise. The United States has worse health than any other developed nation. Yet we spend more on healthcare, sometimes double, sometimes triple, as other comparable nations. Last year, we spent $4.8 trillion, not counting the indirect costs from missed work. That's almost a fifth of GDP. It is tantamount to a 20% tax on the entire economy. No wonder America has trouble competing with countries pay a third of what we do for their health care and yet have a healthier workforce. But I don't want to make this too much about money. It's the human tragedy that moves us to care. President Trump has promised to resurrect America's global strength and our leadership and to restore the American dream. And he understands that we can't be a strong nation unless we're first a healthy people. A healthy person has 1,000 dreams. A sick person has only one. Today, over half our countrymen and women are chronically ill and have only one dream. When I met with President Trump last summer, I discovered that he has more than just a concern for this tragic situation, but genuine care. President Trump has committed to restoring the American dream, and 77 million Americans delivered a mandate to do just that, due in part to his embrace and elevation of the Make America Healthy Again movement. That movement, led largely by moms from every state, many of whom have traveled to be here yesterday and today. Senators, this is one of the most powerful and transcendent movements I've ever seen.